A burn is basically the destruction of the skin, and in certain situations, deeper tissue such as subcutaneous tissue, muscle, and bone may be involved. And a burn may be superficial or deep depending on the extent of the injury. And this condition, which can have devastating effects on affected people, can be prevented most of the time. It affects young and fit people in most cases, and it must be managed properly so that they can return to their normal lives. The causes are heat, dry heat, that's fire, wet heat, scalds from hot liquids, steam and soups, also electrical, as low or high voltage, and chemical from acids and alkalis. The symptoms are pain, as very severe and superficial type, and less in deep burns, the swelling, difficulty in breathing, blisters. The signs that are usually elicited are shock, inhalational injury, bent nasal hairs, soot in the throat, hoarseness of the voice, and black particles in sputum, swelling, blister formation, charring of tissue in deep burns, and ECG changes in electrical burns. Investigations are FBC and cyclin, BE and creatinine, wound swab, blood gases, chest x-ray. Main treatment objectives are to prevent further injury from burns, relieve pain, replace lost fluid, prevent infection of burn wound, aid healing of the burn wound, and avoid complications. Non-pharmacological treatment: you remove clothing from affected parts, you put affected parts under running water if available till pain goes away or is reduced, and if chemical is in powder form, brush it off the affected parts and put under running water. Secure airway, leave intact blisters alone. Do not apply any cream or ointment. Affected limbs should be elevated. A good nutrition, psychological therapy, physiotherapy, and reassure patient. Pharmacological treatment: for burns with total body surface area of less than 10% in children and 15% in adults, you give paracetamol oral. But first, you have to update tetanus prophylaxis. Give liberal oral fluids. Dress burns with sulfadizine. And then you give the oral analgesia, so paracetamol oral in adults 500 milligrams to 1 gram, 6 to 8 hourly. In children 6 to 12 years, you give 250 to 500 milligrams, 6 to 8 hourly. In 1 to 5 years, you give 120 to 250 milligrams, 6 to 8 hourly. 3 months to 1 year, give 60 to 120 milligrams, 6 to 8 hourly. Or naproxen EC oral in adults 250 to 500 milligrams 12 hourly as required. In children is not indicated. Or you give celecoxib oral in adults 400 milligrams that, then 200 milligrams 12 to 24 hourly as required. In children is not indicated. Or diclofenac oral in adults 50 milligrams 8 hourly or 100 milligrams 12 hourly. In children more than 12 years 50 milligrams 12 hourly. Less than 12 years is not recommended. Or ibuprofen oral in adults 200 to 800 milligrams 6 to 8 hourly as required. A maximum of 2.4 grams daily. And children 10 to 15 milligrams per kilogram 6 to 8 hourly as required, with a maximum of 40 milligrams per kilogram daily. And then you give flucloxacillin oral in adults 500 milligrams 6 hourly for 2 weeks rather. And in children 5 to 12 years, you give 250 milligrams 6 hourly for 2 weeks. 1 to 5 years, you give 125 milligrams 6 hourly for 2 weeks. And less than 1 year, you give 62.5 milligrams 6 hourly for 2 weeks. And if the patient has pains of more than 10% in children and 15% in adults, you admit to update tetanus prophylaxis, resuscitate by calculating IV fluid replacement using Parkland's formula as 4 times TBSA, that's total body surface area, times the weight of the patient, given in the form of crystalloids. In adults, we give half of calculated total fluid in first 8 hours from the time of injury, and the other half in 16 hours as ringer's lactate. In children, you add daily fluid replacement to the calculated fluid for resuscitation and administer, as mentioned, as ringer's lactate and 4.3% dextrose in 1/5 saline. So dress burns with silver sulfadizine, and you give opioid analgesia, so morphine IV in adults 2.5 to 5 milligrams for hourly, in children 0.1 milligrams per kilogram with a maximum of 5 milligrams for hourly, or you give Petidine IV in adults 25 to 50 milligrams for hourly, a lower dose in the elderly, and in children 1 milligram per kilogram with a maximum of 50 milligrams for hourly. And then you give clozaceline IV in adults 500 milligrams 6 hourly for 7 days. In children 5 to 12 years, give 250 milligrams 6 hourly for 7 days. 1 to 5 years, give 125 milligrams 6 hourly for 7 days, and less than 1 year, you give 62.5 milligrams 6 hourly for 7 days. If the patient has pains, has TBSA of more than 10% in children and 15% in adults, and also allergic to penicillin, so you give clindamycin IV. As like I said, if a patient is allergic to penicillin, in adults, clindamycin, we give 300 to 600 milligrams 6 hourly for 7 days. In children, 3 to 6 milligrams per kilogram 6 hourly for 7 days. And then you give metronidazole IV in adults 500 milligrams 8 hourly for 7 days. Then in children, 7.5 milligrams per kilogram 8 hourly for 7 days. And if the patient has pains of more than 20% as TBSA, total body surface area, in children, and 30% in adults, is considered as severe pains, and with this we admit to update the tetanus prophylaxis. You resuscitate by calculating IV fluid replacement using Parkland's formula as 4 times total body surface area times weight of the patient, and is given in the form of crystalloids. In adults, we give half of the calculated total fluid in the first 8 hours from the time of injury, and the other half in 16 hours as ringer's lactate. In children, you add daily fluid replacement to the calculated fluid for resuscitation, and you administer, as mentioned, as ringer's lactate and 4.3% dextrose in 1/5 saline. You dress burns with sulfadizine, and you give cefuroxime IV in adults 750 milligrams to 1.5 gram 8 hourly for 7 days, and in children 25 milligrams per kilogram 8 hourly for 7 days. And you give metronidazole IV in adults 500 milligrams 8 hourly for 7 days. In children, 7.5 milligrams per kilogram 6 hourly for 7 days. And omeprazole IV in adults 40 milligrams 12 hourly, or esomeprazole IV in adults 40 milligrams daily. For DVT prophylaxis, you give enoxaparin SC in adults 40 milligrams daily, and in children 2 months to 18 years, give 1 milligram per kilogram 12 hourly. 1 to 12 months and 1 to 2 months, you give 1.5 milligrams per kilogram 12 hourly. Neonates, you give 1.5 to 2 milligrams per kilogram 12 hourly, or you can give dalteparin SC in adults 5,000 units daily, In children 12 to 18 years, we give 2,500 to 5,000 units daily. 1 month to 12 years, we give 100 units per kilogram 12 hourly. Units, we give 100 units per kilogram 12 hourly. And then if the burn is clinically infected, you admit to update tetanus prophylaxis. You take wound swabs and culture for and blood for culture and sensitivity testing. You give IV fluids, you give IV analgesics, and you start IV antibiotics. For first line treatment, you give gentamicin IV in adults 40 to 80 milligrams 8 hourly for 14 days. In children 1 to 12 years, we give 2.5 milligrams per kilogram 8 hourly for 14 days. Less than 1 year, you give 2.5 milligrams per kilogram 12 hourly for 14 days. Or you give ceftazidime IV in adults 1 to 2 grams 8 hourly. In children 1 month to 18 years, that's 25 milligrams per kilogram 8 hourly. Neonates 21 to 28 days and 25 milligrams per kilogram 8 hourly. 7 to 21 days, we give 25 milligrams per kilogram 12 hourly. Less than 7 days, we give 25 milligrams per kilogram daily. Then you give metronidazole IV if the doses as I mentioned, and also clozacillin IV. Second line treatment, you give meropenem IV in adults 0.5 to 1 gram 8 hourly. In children 12 to 18 years, we give 0.5 to 1 gram 8 hourly. 1 month to 12 years with weight more than 50 kilograms, you give 0.5 to 1 gram 8 hourly. 1 month to 12 years with weight less than 50 kilograms, you give 10 to 20 milligrams per kilogram 8 hourly. Neonates more than 7 days, we give 20 milligrams per kilogram 8 hourly. Less than 7 days, we give 20 milligrams per kilogram 12 hourly. You give amikacin slow IV over 3 to 5 minutes. You monitor serum amikacin levels whilst giving it. And adults, you give 7.5 milligrams per kilogram 12 hourly with a maximum of 1.5 grams daily and 15 grams per course. In children, you give 12 to 18 in children 12 to 18 years, you give 7.5 milligrams per kilogram every 12 hours with a maximum of 500 milligrams 8 hourly and 15 grams per dose. Referral criteria: refer all cases of burns with the following characteristics to a specialist. So when partial thickness burns more than 10% of total body surface area, also deep burns of any percentage, burns involving face, hands, feet, genitalia, perineum or major joints, also chemical burns, electrical burns, and any burn with concomitant trauma in which burn poses greatest risk to patients. So inhalation injury, infected burns, and burns with pre-existing diabetes and renal failure.